afternoon, viewers. Welcome to Panorama. As confirmed cases of COVID-19 continue to rise in many states of the country, curbing community spread becomes a major concern of authorities. Stay-at-home order through lockdown and observance of other preventive and containment procedures are being taken seriously by state governments, while new NCDC testing centers take off to clear samples collected for testing. I am Abubakar Muhammad Musa. On 21st of April 2020, the National Center for Disease Control has confirmed 117 new cases of COVID-19, bringing the total number of confirmed cases in Nigeria to 782. The number of deaths stands at 25 and discharged persons 197. A breakdown of the new cases of COVID-19 reported in some states indicates 59 cases in Lagos, 29 in FCT Abuja, 14 in Kano, 6 in Borno, 4 in Katsina, 3 in Ogun, and 1 each in Rivers and Bauchi. Communities with the Presidential Task Force placing heavy surveillance on Kano, Oyo, Osun, and Edo states for new cases of COVID-19. This was made known at the daily briefing by the task force in Abuja. Humanitarian, tell us more.
The Presidential Task Force believes the fight against COVID-19 is a war with an invisible enemy. While more COVID-19 cases are treated and discharged, there is, however, a surge in new cases, prompting the Nigerian Center for Disease Control to intensify search for coronavirus in high-risk areas susceptible to community transmission nationwide.
We are closely monitoring Kano, Osun, Oyo, and Edo. We note the particular concern with Kano, and we have engaged closely with the state government.
23 rapid response teams have been deployed, and this strategy requires more testing kits and diagnostics.
As part of the support to the states, the Presidential Task Force has approved the distribution plans for medical equipment and consumables available in stock to the states.
Several ministers gave updates on sectoral responses to the pandemic.
The Federal Ministry of Information and Culture and its agencies have ramped up the public enlightenment and advocacy campaign. You must ignore the vaccine being hawked in Kano, which is called COVID-19 vaccine. It's yellow in color. It is not certified by anybody. Please don't patronize the hawkers.
We have deployed 279 trucks of grains to these 3 affected states locked down by the federal government, Lagos, Ogun, and the FCT. We are making plans for the next deployment.
About 14 or 15 states have already commenced learning via different channels that are available in their states, mostly radio and local TV.
Once you see a flight approved, it's diligently done. It must be essential. It must be COVID-19 related.
We have mapped out 125 aircraft and 13 airports across the country for decontamination. We are currently disinfecting 150 high-risk areas, again around the 774 local government.
Nigerians were advised to use cotton fabrics for the production of homemade face masks as against patronage of nylon or polyester fabrics. In Abuja, NTA News.
Worried by increase in number of cases of COVID-19 in Borno State since the pronouncement of an index case last Saturday, University of Maiduguri Teaching Hospital has established a triage room to facilitate process of testing by the new NCDC testing center. Yagum Subukar reports.
This is the University of Maiduguri Teaching Hospital center designated for the testing of suspected cases of COVID-19 for the Northeast region. I have here with me the Chief Medical Director, UMTH, Professor Ahmed Ahijo, who will talk to us on the level of collaboration of the hospital and NCDC for testing of COVID-19 cases. Sir, can you please tell us the level of collaboration between the hospital and NCDC for testing of COVID-19 cases from the Northeast region?
The Nigerian Center for Disease Control have installed the facilities for the diagnosis last week in our own laboratory, and since then we have already done so many cases, and we have got the contacts of the first index, that's the index case. We have been tracing the contacts and we have been making the diagnosis. Some of them turn out to be negative. Most of them are negative, and a few of them turn out to be positive. So we are working hand on hand with them, and they have been supplying us with the diagnostic material and all other supportive facilities for the management of COVID-19 patients.
Okay, sir, now that we have confirmed cases of COVID-19 in Borno State, what is the situation at the isolation center of the institution?
I believe on the isolation centers, we need even more isolation centers in the state to prepare, because nobody will know the extent of this pandemic. In other climes, you may see even hotels, stadiums are converted into isolation center. So preparation to have more isolation center, I think, is a very positive thing in the right direction.
As at this morning, there are 10 confirmed cases of COVID-19 in Borno State. 9 were diagnosed here at the center, while the other one was brought in from Gombe State. It is expected that the 14-day lockdown scheduled to commence this evening will no doubt assist in curbing the spread of the pandemic. Let's continue to stay safe. It's back to you in the studio.
Thank you, Yagumsu. Today marks the 56th year of meritorious service from the Nigerian Air Force, and there have been series of activities marking the anniversary. However, this year's celebration is quite different. Let's now join defense correspondent Naja'atu Tijani live to tell us how so.
Thank you, Abubakar. I'm live at the headquarters of the Nigerian Air Force, where earlier on I told you about the NAF Day celebrations, but this year's anniversary is being marked in a different way. You just missed a spectacular display of 3 jets, the L-39ZA jets, and you can actually see them in the background. They might be a bit too far for you to see, but they're actually in the background and I can still hear them. They're flying past to commemorate the Nigerian Air Force 56th anniversary. And the Chief of the Air Staff is also here with some branch chiefs to witness the fly past as well. The planes, the 3 jets have flown past 2 times already, and they're expected to fly past for the 3rd time. The Chief of the Air Staff is standing by to also tell us more about the NAF Day celebrations like he did earlier at 10 in the morning. So we're expecting the jets to fly right now, the 3 of them, and we're standing by for that. Any minute from now, the jets will be flying past. And like I said earlier, the Air Chief and some of the branch chiefs are also standing by to witness this historic event. It's the tradition of the Nigerian Air Force to display air power on such occasions, and here they come. Sporting green, white, green, the Nigerian flag, the colors of the Nigerian flag, a tribute to what's happening in the country. It's not just about the Nigerian Air Force celebrations, but the Air Force is trying to raise awareness about the coronavirus pandemic. And with me here is the Chief of the Air Staff to tell us more about this year's celebration, why it's being celebrated on a low-key, and what the Nigerian Air Force is doing to fight the coronavirus pandemic.
Thank you so much. I want to say that today we are celebrating the 56th anniversary of the Nigerian Air Force. You remember that the Air Force was established in 1964, and this year's celebration is low-key because of the situation on ground. The COVID-19 pandemic is a serious problem that is not only affecting Nigeria but globally. So what we have decided to do is to take some time out, at least to remember those that have given their lives, so that we all can remain alive and our nation can remain a united nation, so that we all can continue to pursue those unique values that we hold so dear to our hearts as a people and as a nation. So we feel that despite the pandemic, we should spare some time to remember those that have given their lives. In terms of our contribution to the COVID-19 pandemic, dealing with the COVID-19 pandemic, the Air Force has been flying all the officials of NCDC and those other officers of government that need to be flown around to ensure that they are able to coordinate activities. We have flown over 151 hours as at this morning, and we are still working to ensure that we give maximum support to the PTF so that they can be able to discharge their responsibilities. In addition to flying the personnel, of course, we have also moved so many items from Lagos to Abuja and to other parts of the country in terms of testing kits, hand sanitizers, masks, and other things. So I think as a nation, we have every reason to thank the Almighty for giving us a service that has not only projected air power within Nigeria, but has projected air power even beyond Nigeria in support of other countries, and also have a service that is able to support the current efforts to contain COVID-19.
Finally, sir, I can see you and your men all in surgical masks. I want to know if the Nigerian Air Force personnel observe the strict code of hygiene which the federal government is encouraging.
Well, certainly from what you have seen, you can see everybody is, like all of us are coming out of surgery. But the fact of the matter is that we are abiding by these guidelines because that is the way to go. And that's why in the morning you also saw the helicopters with a banner saying that we should stay safe, respect all the guidelines given to us by the federal government. In addition to that, we have conducted a number of research and development in the Air Force Institute of Technology for the production of ventilators, which right now we are working hand in hand with Ahmadu Bello University to see how we can test these ventilators and deploy them for use not only in Nigeria, in the NAF hospitals, but in other hospitals even outside the Nigerian Air Force. In addition to that, we are producing the PPE in Port Harcourt and some other items that are going to be useful, I believe.
Thank you very much,
Thank
sir.
you so much.
So that was the Chief of the Air Staff, Air Marshal Sadiq Baba Abubakar, telling us about the Nigerian Air Force efforts to complement federal government's fight against COVID-19, which includes research and development and movement of equipment, among others. It's back to Abubakar in Maiduguri.
Very well, Najatu, thanks for that. This is Panorama, and moving on now, Borno State government has imposed 14 days lockdown in the state with effect from Wednesday, 22nd April 2020 at 10:30 in the evening. Governor Babagana Umar Zulum announced this in a statewide broadcast following confirmation of an index case of COVID-19 in the state. Mohammed Guni reports.
The National Center for Disease Control had last Sunday night confirmed an index case of the coronavirus disease 2019 in Borno State, which took the life of a retired health worker. Governor Babagana Umara, in a broadcast, acknowledged sacrifices of all health workers whose dedication to saving lives, he stressed, will be needed more than ever before.
I'm worried about the manner in which the index COVID-19 case in Borno State was handled. I'm setting up a panel to investigate the circumstances surrounding the outbreak and handling of the index case in Borno State.
The governor, who described the COVID-19 as dangerous disease without cure, also reminded the general public that the solution to the pandemic is prevention, adding that citizens of Borno have a shared obligation to ensure the pandemic does not spread in Borno State.
I'm hereby directing a lockdown that will require cessation of all movements in Borno State for an initial period of 14 days with effect from 10:30 p.m. on Wednesday, 22nd April 2020. All citizens in Borno State are to stay in their homes.
The 14 days lockdown, according to the governor, include restriction of gathering, while offices and business activities in Borno are to be fully closed down during the period, adding that the restriction will not apply to providers of essential services, which the high-powered team for prevention and control of COVID-19 in Borno will make public. Professor Wagana Umara said the high-powered team on COVID-19 will on daily basis provide citizens with timely updates and information on essential needs such as food, medical services and automated banking services. In Maiduguri, Mahmoud Kuni, NTA News.
From measures for the prevention of spread of COVID-19, Borno State has now entered a second phase of containment of spread since 3 cases were confirmed within 2 days. This development has triggered a chain of activities with stringent measures from border closure to a lockdown. The Commissioner for Home Affairs, Information and Culture, Babukura Abuja, is here to give us an update on the current situation in the state. You're welcome to Panorama, sir.
Thank you so much, Mom.
Okay, sir. To start with the emergence of an index case and more confirmed cases coming up in Borno, what is the committee doing about, increasing and sustaining levels of awareness on prevention?
Well, with the coming board of this index case, it means that, we have gone into community transmission. And therefore, it is the responsibility of any responsible government to take any measures that can, curtail or oppose or to contain that phenomenon. This is something that, all of us know, including those within the medical profession and out of it, that there is no cure for it. The vaccines are not yet available, although there are some rumors or some hints that certain vaccines are going to be put into trial tomorrow. The best thing that we can do, as it has been spelled out by His Excellency, the Executive Governor of Borno State, is nothing else but prevention, prevention, and prevention. To prevent this, we are so vulnerable in the real sense of the word that we have both sharing common boundary with 3 countries, 2 in Central African Republic and 1 within the West African sub-region. In addition to that also, there are many people, because of our communality, communal sets of life, the lockdown has to be imposed, and at the same time has also bring in the members of the security and well-meaning other organizations to ensure that people do not move within that period. In addition to that also, those commuters coming into Maiduguri have been stopped forthwith since last week. If you could remember, we have been at the inlet into Maiduguri for close to 3 days, leaving our home 6 o'clock in the morning and stay there at about 10 o'clock to ensure that all vehicles who are coming into Maiduguri are within the ambit of the law, like those carrying medical supplies, those carrying foodstuffs, and of course emergency materials meant to be used in our hospitals. So as for now, so far so good. There is a certain level of compliance. As we go into the total lockdown tomorrow, we will make sure that totally the people's movement are restricted in the coming 14 days, but not without the human face. There are some 5 designs.
Did you say tomorrow? Is it tomorrow? I thought it's coming up tonight.
Well, coming up tonight, but tomorrow morning there will be no movement.
Okay.
Because it is going to take effect today by 10:30 p.m. And you do know that 10:30 p.m. within in our own case, we are already under a curfew imposed as a result of the insurgency that we have been facing for the past 11 years. So therefore, there is certain serious stringent measures that have been taken to ensure the safety of life and property. At the same time, also those vulnerable members or sector of the community, they are also going to be taken care of, particularly the IDPs.
All right, sir. What procedures are in place to effectively monitor the lockdown, to ensure there is no breakdown of law and order? Any collaboration with security agencies?
Well, if you have listened to the speech of His Excellency, the Executive Governor of Borno State, Professor Babagana Umarazun, he has spelled out that, this is going to be done in collaboration with all arms of the security agencies. And you know, Borno State is one area where you have massive presence of security outfits. The Air Force, the Army, the Navy, the police, the civil defense, the migration, the custom, and all these things working in collectively under the auspices of this operation, Lafia Dole, in addition to the existing conventional police, SSS, and civil defense that are also giving their own, you know, contribution towards the insurance of safety of public and of course their properties as well.
Okay, sir. With the 2 weeks lockdown, what palliative is the Borno State government, you know, preparing for the poor and IDPs, mostly in camps?
If you have listened to His Excellency's speech, he has specifically spelled out that there is going to be a lockdown for 14 days. But this does not mean that the vulnerable section of the society will not be taken care of. So government has already put some measures in place so that, you know, the effect of the lockdown is not maximally felt in terms of the needs for, you know, essential goods, the needs for, you know, the food to eat and all these things. You know, we're just going into the Ramadan, inshallah, in the next few days. And to concretize this, there are certain designated marketplaces within Maiduguri that are going to be giving services after some days for the general public to go out and get then requirements, and then the lockdown continues. Those areas that specifically to mention, you have the market at the Baga Road, which is a very large one that can take care of those living within the Baga Road, Ijajeri, Umarari, Bolori, and the federal locals and the Pompomari housing estate. You have the Bulunkutu market that will also service those people living around Bulunkutu, Ngomari, Muruganari, and of course, you know, the Bintu Sugar, all the Dala, you know, we have series of Dala, so I don't need to mention all the names. These are the areas that they are going to, you know, look for the services whenever they want to buy certain things. There is also the Borno market, the one in Jare that we call the Kuri market, the vegetables market, and then you have the milk shop area, better known in the local parlance as Gira Madara or Chamkuri in Kanuri. So these are some of the measures being put in place by the government of Borno State and the committee, so that you know, people do not, you know, run into short supplies as far as the requirement of food and drinks are concerned. So I think so far the measures are okay, and enforcement is also key, and that's why I mentioned all this arms of the securities, including our civilian JTF operatives. And should in case certain things arises, emergency, like in an area where you have you know, a woman, you know, trying to give birth, or all these things, there are people who are assigned to evacuate them, to take them to the nearest clinics.
Okay. At this juncture, I'd like to say a very big thank you to you for being part of Panorama this afternoon.
Thank you very much for inviting me, and stay safe.
Okay, that was the Borno State Commissioner for Home Affairs, Information and Culture. This is Panorama. Let's take a break now. There will be more stories shortly.
The National Center for Disease.
Thank you. So you have to hold on for them to ask you to leave.
Fellow Nigerians, follow the instructions on social distancing. The irresponsibility of the few can lead to the death of many. Your freedom ends where other people's rights begin. The security agencies have risen to the challenges posed by this unprecedented situation with gallantry, and I commend them. I urge them to continue to maintain utmost vigilance, firmness, as well as restraint in enforcing the restriction orders, while not neglecting statutory security responsibilities.
Confirmation of 9 cases of COVID-19 in Borno by NCDC, within a span of 3 days, has set a chain reaction with the state high-powered response team for the prevention and control of the coronavirus pandemic, stressing the need for a strict enforcement of the lockdown of Maiduguri coming into effect this night. Pauline Kujevana has an update on the committee's daily briefing on the COVID-19 situation in Borno.
Out of the 48 samples from the 104 contact persons of the index case, 9 were tested positive, in addition to Borno citizens who was tested positive in Gombe State, making it 10 confirmed cases in the state. According to the chairman of the committee, the Deputy Governor Umar Usman Gadafar, the citizen has since been moved from Biu to isolation center in Maiduguri, just as surveillance team was sent to assess and take sample of contact persons in the area.
We are now emphasizing the issue of preventive measures. If we all put our hands together and campaign vigorously, I know our campaign will yield positive results.
The Commissioner of Health, Dr. Salisu Kwayabur, said most patients of coronavirus do not show symptoms and call on the general public to go beyond washing hands and using hand sanitizers by ensuring physical distancing and avoiding indiscriminate touching of eyes, nose and mouth.
We have a couple of drugs that have been tried. Even though there is no regimen or treatment that has been approved but has been found to be useful for the treatment of COVID-19. Trials are ongoing and people have chosen several regimens. We've chosen one of the regimens to test for our people to see how it's going to go.
The committee maintained that the state has adequate facilities to manage patients, control spread of the coronavirus pandemic, and provide public with update on the situation. In Maiduguri, Pauline Kujevana, NTA News.
Worried by the growing hardship on the people as a result of the coronavirus pandemic, the Department of State Service, DSS, has donated food items to orphanages and internally displaced persons camp in Maiduguri. The humanitarian intervention by the Director General of the DSS, Yusuf Magajid Bichi, is a palliative measure to support the IDPs and indigent in the society. Rebecca Baturi reports.
Department of State Service, DSS, is a principal security agency of Nigeria that also engages in corporate responsibility services to the community, especially at this time of need. With the coronavirus pandemic spreading and affecting the economy as well as the living condition of people, especially the vulnerable, the DSS deemed it necessary to reach out to Khan Center Internally Displaced Persons Camp, Fatima Ali Sharif Orphanage, Victor Flores Islamic Foundation and Within Care Foundation. The Director General, DSS, Yusuf Magajibichi, represented by Borno State Director, Momo Murtala, donated some food items as palliative to cushion the effect of COVID-19 being experienced in the country and the state in particular. Executive Chairman, State Emergency Management Agency, SOMA, represented by Director Operations, Abdullah Suleiman, thanked the DSS for the gesture, saying it will go a long way in relieving the hardship of beneficiaries.
Always thankful and grateful for organizations, corporate bodies like this one that we have just witnessed. We appreciate their effort for extending the palliative measures they had to do for beneficiaries.
Beneficiaries from all the places the donation reached expressed appreciation for the gesture for the Department of State Service.
Mun gode wa Allah, mun gode musu domin wannan tallafi da suka yi mana.
In Maiduguri, Rebecca Baturi, NTA News.
All for Panorama from Maiduguri. Stay at home, observe social distancing for your safety and others. Good afternoon to you.